is I'm no longer using self-ligating braces on my top teeth. After a considerable amount of time, and the gap here that was created when my tooth was pulled would not close. My wires kept slipping. I kept having multiple problems. Now, mind you, I still have them on the bottom, but that's because they're done. They're just waiting for the top to catch up. What I never thought I would say is that absolutely do not get self-ligating braces if you have anything more complicated than a simple straightening of teeth. If it can't be fixed by Invisalign, then certainly you don't want self-ligating braces. My bottom teeth straightened up really quick. We're done way early, probably within 20 months or less. However, my top teeth have been something else, and every time we think the gap is closed, on this side it opens back up. Some exciting stuff that I've had happen is, one, my center line is, and I'll go over it a little bit more once I get done talking. My center line is better. My overbite is gone. I did discover that I'm allergic to latex and had a huge reaction. My mouth swelled up. It was awful. I had sores all over my mouth. So do not. Apparently, I don't know that much about latex, but it's a buildup type thing from what I understand. So I just recommend getting non-latex bands if you are able to, or request them from the orthodontist. So just an update, I have now just ceramic braces on top. My wires don't slip. My teeth are moving quicker. I wish I had done this a long time ago. Even my orthodontist is saying, maybe we should have done it this way to begin with. I just try to make my patients happy. So going forward, if you have anything major now, and I had an overbite and a crossbite, had a tooth pulled and have moved my center line all the way across, and then I had my gums needed to be trimmed. Now, I've had my gums trimmed, although it didn't quite go as well as they wanted. Still needs a little bit more work. So we're going to wait till the finishing, which at least 6 years. I was hoping it would be by May, which will be 6 years, but it doesn't look like that's going to happen. So now I'm 54 and I still have braces, and I started when I was 49. So let's just look at it's gone on. This is my center line right here. It's almost lined up here, which it used to be a whole tooth off. This is all moved over here. As you can see, there's still a gap, and this is a real big problem. The gap has not been closing. This is where there was a tooth, and this is how the center line got corrected. That's part of the reason we went to this type of braces. This side, this side has a bigger gap between the edge of my lip and my teeth, because it bows in on this side because of it trying to close in. But once that closes in, then we'll work on getting the bow out of it. There's my smile. It has changed my face a little bit more than I expected. Gained a little weight too. So if you look at my line on my gums, it is better, but it's still off on this side, so we're going to work on that more once we actually get the teeth closed. Overall, I've gotten used to my braces. I've learned a lot of tricks and tips, and I don't carry a whole bunch of stuff with me anymore. I buy those disposable braces. I carry the intradental, and I have some silicone wax with me, and that's pretty much all I carry, and I can throw all of it away. It's very hygienic, and I don't need all that other stuff I used to start with and all those little kits that everybody brings. So one of the things I can say is just get some disposable toothbrushes. I got mine on Amazon for $72 for like 15 bucks. Get some intradental brushes. I got, this is what mine look like. I carry them with me everywhere. They're really great. They help you get that stuff out of your teeth in the middle of the day. And then I use a water pick, which I swear by. I don't think I would have ever been able to keep my teeth clean without it. So that's an update. As I said before, please do not use the self-ligating braces if you have anything complicated on your teeth. And like I said, I had an overbite, which is corrected. Yay! And I no longer my bottom teeth no longer cut up into my gums and the back of my top teeth, so that's good. The self-ligating braces worked fine on the bottom. They're just hanging out on the bottom until the top catches up. But I've seen more movement in the past 3 months since I got the regular braces versus the self-ligating braces in the last 3 years. So that's promising. I haven't had a lot of pain, but of course I'm pretty used to it now. There was a little bit of having to wear wax when I first started wearing them, but other than that, I haven't worn wax for a while. I think I've just adapted to having braces at this point. And I'm a new grandma. My grandbaby's 3 months old. I'm so excited. So we've had lots happen. We've had a couple of weddings, a couple of graduations, all which I didn't want braces on for, and of course I've had braces on for. So it is what it is. I'm committed to getting this done. At this point, there's no going back. So hopefully I'll have them off before I'm 70. But again, I would recommend not going with self-ligating braces if you have any type of complicated bite or correction. It's been great seeing you. I'm sorry for the late update, and I'll try and stay updated more often. Thanks.